Literally every third person has knee issue or back issue.
Unfortunately, we do not condition ourselves. People say that I was all okay till I was 30 years old. And suddenly I started experiencing pain. It doesn't happen
Suddenly.
It's about the lifestyle that we have been leading throughout. Rest is not the solution. You need to ensure that you modify activity and get better and stronger.
You were a part of this case, the 21-year-old girl.
Yes.
It was scary because there was such zero muscle strength, like her eyelids wouldn't open. And then she was on steroids and all of those things. And then she came and started exercising.
Right.
She got off steroids and the doctors were shocked.
But this is what exercise strength can do.
Hey, what's your point of view on plyometric training? People are scared of it.
There's a way to approach it.
When you trained me for my first full marathon, you were not running.
No.
You were only training us brutally. Killing us every day with strength and runs. How does it feel to become a hardcore marathoner yourself now?
I'm not a hardcore
You just did a
marathoner.
half marathon this morning and you're here looking fresh as a flower.
That was an easy run. I just tried to keep it in my zone 2, 3. It's all about conditioning, how you condition yourself. See, all those elite runners, when they run half marathon in 1 hour, it happened only because they are conditioned over a period of time.
Over a period of time, yeah.
Unfortunately, we do not condition ourselves. That's why when you were doing that marathon, I had to ensure that you go through that amount of tissue resilience. Because if you do not build up that tissue resilience, then marathon becomes extremely difficult. And in that marathon, and that was your first?
My first.
And just imagine, what time did you finish?
Yeah, sub 4.
Sub 4. How many marathon runners in the first marathon they have run of sub 4? We do not realize.
With 2.5 months training.
With 3
Max
months.
3
months training. How many of them have reached this timing of finishing it in sub 4? So that is why first is, when we work, understanding who you are as a person and then planning the gym is very important. So that's why we always say, treat the person, not the condition. Because the person comes with a lot of history, a lot of background. So with empathy, we need to listen to them as much as possible. We listen. We understand a lot regarding who you are as a person and what would be your potential based on your history, your past, and then channelizing it and supporting you in every way possible. And there you achieve your goal.
This is why I said he plays with your mind.
Yeah. And
If
You go to Somya Rout with an injury, then you'll forget you had an injury and you'll train that same joint and muscle.
yeah. And you would be training harder than you
whole
were
lot
training
more.
before. Yeah.
And you would have forgotten that the pain is
you
there.
have to overcome it. People don't overcome this stick. I always tell, if there's a circle, okay, now circle is your activities of daily living. Pain is just a dot. But what happens? That pain takes over the entire circle.
Yeah.
Yeah.
Then what happens? It kills you mentally
Yeah, of course.
and physically both.
It becomes your life. Your life becomes only about that pain. You decide to cut movements out because of that
Out
pain.
because of that
So
pain.
research evidence, they all are telling about exercise in a way where you do not cause any harm, but rather empower it more and more, and they get better and stronger.
Yeah.
That's rehab. Rehab is not about just doing. See, if Rishabh would be in his 60s or 70s, then I would have been doing all those band-aid exercises, simple exercises for him, because he doesn't have a goal. He's young, and injuries, niggles like this do happen.
Yeah.
But it is not that bad to that extent, because if you see him symptomatically and movement-based, whatever the investigational findings say doesn't have any correlation. If you go through only biased by the investigation finding, then you would ask him to stop, go under the knife. Doesn't have. That's why it's very important for all of us to understand, okay, I have so many things going on. My MRI finding says there are multiple things. It's like a paragraph.
Yeah.
But when I'm moving, I'm able to move, I'm able to climb stairs, I'm able to climb downstairs. There's no correlation between the two. Now, why do we jump for a surgery is the question.
You're always stronger than your MRI. That's the point.
Absolutely.
Yeah.
Definitely.
Yeah. That's a good point. Yeah.
And he has always been fit, exercising, strong. So we have to ensure that he gets supported properly.
Correct.
Because I'm just
Thank
the
you.
support system.
Thank you. For the first time in my life, I'm
Getting appreciated.
getting appreciated by Somya.
By you. He said by Somya. Not appreciated. Yeah.
Yeah.
I always get appreciated by Somya.
Yeah, absolutely.
That's why I'm able to do my best.
You are reaching your potential, actually. He has a lot more.
Got it.
He is supporting you. Rather, he should, get better. And he has a lot of potential. So
And he will, I think. He will get,
100%.
obviously.
100%. That's what I want him to be there.
That's
Why I said what you did is wow, great. But what he did, he should have.
Can you say
could have
something
done
here? Can you just...
He was supporting you, rather. Rather, he should have pushed himself.
See, he knows both of our
Yeah.
body, potential, injury, etc., lifestyle, what we do day in and day out,
Yeah.
That's why.
And he's done wonders for both of us
Yeah,
in
of
terms
course.
of our
Of course.
pain management,
Yeah.
fitness, everything. So I guess we just have to quietly listen.
I'm
And
listening,
say,
yeah.
he's saying you do better, he's saying you're doing
I-
best. So accept it.
No, I told him also, I have never ran so much, the amount
That's
of
true.
runs that I've done. And I still don't think I have the engine to run the way I'm running. I only run
No, engine you have.
because I have committed
intention.
to Somya. I just go and run.
He has the engine. I think it's the
absolutely.
intent.
Belief.
No,
Belief
his
and intent
intent
both.
for running is not very strong. Okay, he is not a fan of running.
But if you ask me to run, I run.
Now he's
He ran a 10K in
That's because-
52 minutes or something.
49
no
minutes.
49.
Sub
Yeah,
50. Correct.
yeah.
Correct. Sub 50.
I at least enjoy
See, I'm saying
running and I've
49, he's
embraced
listening. He's hearing 52.
it. Which is why he's saying you do more. Amazing.
Okay.
Yeah, let's get down to asking some interesting questions for our audience.
Yeah. So you work with people who want to be active, who want to be fit, but the reality also is that most people that we know of have some sort of pain, some sort of niggle. They may have had past injuries. They may not have had injuries, but they feel they have an injury. What, in your opinion and your experience, is going wrong? What is the mistake that they're making, and how can they just go about it?
See, pain is an unpleasant sensation that affects you both mentally and physically. That's what the definition says. And as we slowly age, the most important area that we need to prioritize is muscle, the quality of the muscle that we have. And slowly the muscle starts deteriorating. We start losing strength in the muscle. It's like people come and say that I was all okay till 30 years old, till I was 30 years old. When I reached 34, 35, and suddenly I started experiencing pain around the knee. It doesn't happen suddenly. It's about the lifestyle that you have been leading throughout, the amount of stress that you have been taking over a period of time. Your sleep has been compromised to a greater extent, where there's a lot of research article which connects to pain around the knee and low back because of chronic mental stress. So we can't ignore that as well. That's why we call it as psychosomatic, where a lot of stress causes pain in the body. And the important part right now is educating them regarding what exactly has happened and taking them through a process where they start exercising. Now, exercise has never been our culture, if you see. And when we are in school, we are not educated enough regarding exercise, regarding posture, regarding movement.
Yeah.
That's where, as we grow older, we start experiencing pain. The important part right now is to ensure that everybody they have a better learning about their body. We all are very unique,
Yes.
and we move in a different way.
Yes.
We have our strengths. I never say weaknesses. We have our strengths, and we need to understand and recognize our imbalances. Like the book says that this is a proper posture, but we are never like the book. right? Because we have evolved over a period of time, and the way our occupation, the way we move, everything has changed. So that's where it creates stress in different parts of the body. Nobody says that I have pain everywhere.
Yeah.
They say that I have pain either in my right knee or my right side low back. So it's very specific. So recognizing why right and not the left, treating the cause is important, and then helping them through a better routine, regime to overcome pain. Two aspects to it. One is pain management and exercise therapy to overcome. For every musculoskeletal pain,
Yeah.
exercise is very important.
Yeah.
Yeah, but do you also think that too much too soon is happening with people?
Yes, that's one
because
more.
no one understands loading,
Correct. Correct.
like the whole concept of progressive loading, and it's not like the day one you step and you pick up a weight.
Correct. See, what's happening now is everybody realizes that they have to exercise. But there is no guidance in terms of how to start. Nobody even undergoes a musculoskeletal screening. Because it's all about exercise, movement, loading. So you learn about yourself. You also need to understand, get a blood test done. Understand your, parameters which are less so that you can always replenish. You also need to ensure that you do a fitness testing in terms of how you squat, how you lunge, how you bend forward, what is the mobility you have around your ankle, around your hip, and obviously based on how you move, you have to modify.
Yeah.
Right? Like for example, I keep saying, people say that, oh, I have a pronated foot, say for example. Like lot of us do have pronated foot. Naturally. And they also do, when they do any aggressive movement, the foot goes for overpronation.
Yeah.
The challenge here is, the body, the brain has been adapting to the that particular form, posture of the foot, but we call it as foot posture. Now, we cannot change it, but rather we need to empower it as much as possible.
Yeah.
See, that's where the difference lies. So they need to realize, understand, and then work on the muscles which are deeper muscles. For example, we talk about transverse abdominis, we talk about gluteal strength, we talk about vastus medialis obliquus, we talk about the soleus strength, instead of going into larger muscles. So smaller muscles, we need to start with smaller muscles, recognize it, have a better neuromuscular control, motor control, and then progressively load to get better. Optimal loading is very important. Nobody understands what is optimal loading. Loading to a point which is enough to have adaptation.
I think training with him, I've learned optimal loading. You just mentioned that no one comes and says, oh, everything from top to bottom is hurting. I felt it training with you. Like I walk into the house and Vivek looks at me, I'm like, every part of my body is hurting.
And if it doesn't recover within 24 to 48 hours, then there's a difference between discomfort and an injury.
Yeah.
So people need to recognize that.
Yeah.
Yeah.
I think what I've also seen is, like, for example, we all have some pains or the niggles. We like train hard and play a sport and things like that.
Yeah, of course.
So in my personal example, sometimes there is a niggle around my right knee. It's not that bad. It doesn't limit movement for me. I power through it. I squat heavy. I run everything. But the times when I'm training with you, we are still training pretty hard, I believe.
Yeah.
But then I don't have those niggles anymore.
Right.
So I think there is something about
loading,
the magic in training in different planes of motion.
Yes.
Making sure that you explore end range of motion, start loading it the right way, in a safe way, with the right person. I think there is magic in doing that.
100%. I couldn't agree more, because that was my biggest learning 3 years ago when I started training with Somya. Of course, I went with an injury, IT and, weak right chain, right glute, all that. But I think that was like, you and I have been doing our own training for so many years and, building programs and etc. And we do it as carefully, meticulously as possible. But I think a lot what I learned from him, I don't think a lot of the books also taught us.
Experience. I think that's
No, experience. And I think how a physiotherapist
Correct.
approaches exercise therapy is
Yeah.
very different from how just, like a lot of the strength and conditioning people
Yeah, it's
would.
very different. I think what we need
Yeah.
is, what we need as a fitness industry is a good combination
Yes.
of both. And I see that gap all the time with, and I'm not trying to put anyone down, but with physical therapists,
Yeah.
it's mostly about pain management
Yes.
and not about pushing the
Exactly.
threshold.
Yeah. With all due respect to everybody, everyone's doing great work in the industry. But yes, there is a difference.
Yeah.
And we've experienced it with him.
Yeah.
Right? And I also feel like that's also my learning, because the coaches who have all trained with you, like, our coaches who've trained with you.
You mean the My Third Space coaches?
Yeah, the coaches who've trained with you definitely approach exercise
Yes.
differently.
Yeah.
Like I can see in how they all train their clients and how we're able to program differently.
Yeah.
And everything has to do the way we learned from you, 100%. Like we get a lot of knowledge from doing courses like your NASM, CSCS, etc. But training with you has always been
You need both.
different and
Yeah, you need both.
Thank you so
No,
much.
why we're saying that is because I think both of us recognize that it'll be great for all the coaches across, not just in Bangalore or wherever, but if the whole learning system can come, using the knowledge of a physiotherapist.
Correct.
Right.
The coaches can become fantastic coaches.
Fully agree.
But now talking about injuries, right? Like we spoke about loading, how to start optimal, progressive. Why do you think, this is again what we've noticed, and you being in the industry can also see, literally every third person has knee issue or back issue or lower back issue. And whether they train or not, it is just there. Why do you think this is happening? How do we avoid it as well?
No, there are a lot of parts that are vulnerable, in the body. But especially, also they complain of pain around the neck, around the upper trap. They have headache.
Yeah, a lot.
Oh, yeah.
A lot.
Yeah.
So the challenge here is, again, I go back to your lifestyle that you have been leading over a period of time. Or they come to me after they get involved in a sport, into a recreational sport. Might be pickleball. The challenge here is we need to recognize it as a sport. We all are extremely competitive by nature. So when we go and play sport, we have to meet the demands of the sport. We get competitive, we push ourselves, and then we realize, oh, my right knee is hurting. It's only because you are right dominant, you would lunge more on the right. And the right knee doesn't have that capability, the muscles around the knee doesn't have that capability to absorb the load. That's where there is stress. Now, for example, people come and, especially golf and badminton, recreationally they all play. It's always rotation towards one side when they play golf. They have to strengthen the hip more. But unfortunately, they use the shoulders more as compared to the hip. Badminton.
Yeah.
Badminton is a sport, badminton is the fastest sport in the world, where a shuttle travels over 300 kilometers per hour. Just imagine the amount of movement it requires. In one rally, there is acceleration, deceleration, there is jump, landing, explosive movements. So when you go and if you do not train those movements, you are bound to have pain, injuries, and there is also peer pressure. Okay. Now, if your friend is doing a particular movement or a particular sport, without recognizing, without having a proper assessment of how you move, what your imbalances are, you jump in. That's where, the pain, discomfort, that's the only way body speaks to us. So it's important to address what is this pain all about, and start working on it in a way where you overcome pain. Pain management is just one aspect. As I said, that pain is 100% from brain. We have just receptors in our body that send signals to the brain. So recognizing it and working on, again, strength, muscle is very important.
This pain is 100% from the brain. I have to...
Large part of it.
Yeah, I have to decode this thing. Because, when people come and tell you that they have pain, how do you convince them that...
No, I got convinced.
You and I have been, working.
Pain, there's a difference between discomfort and pain.
Yeah.
So I say when you have discomfort, it's information. But pain limits you. It's warning. It limits your day-to-day activity. But when you ask them to sit, they would be able to sit without pain.
Yeah.
They could, if you ask them to get into a deep squat and complain of knee pain, they would say, oh, I'm able to go down deeper. So we have to understand what is it that is the difference. Like most of them complain of pain on the right, and when you ask them to squat, they'll be shifting the body weight towards one side all the time. And they would say, I'm able to do 100 kg squats, for example, I'm saying. So unless they recognize it, that your body is always shifting towards one side, you're loading one side more. That's the reason why you have pain. That doesn't mean that you would limit everything. Now, rest is not the solution, as I keep saying. You need to ensure that you modify activity and get better and stronger. So always active rest is recommended rather than passive rest.
Even on rest days.
Yes, that's active recovery.
Yeah.
So what can they do? As in someone, let's say, who gets low back niggles a lot. Maybe there's no injury, but it can niggle without an injury.
Absolutely.
What can they do on their own at home or wherever to make sure that they're able to manage it?
First of all, we need to understand whether the pain around your low back is because of the low back or because of the associated muscles. For example, if you have a hamstring tightness, that causes stress around your low back. If you have hip flexor tightness, that also causes stress around your low back. So unless we recognize the cause, we can't say that it's always my low back is strained. So whenever you have any pain around your low back, see, lumbar area has the maximum movement. Knee takes the maximum load when we move. That is the reason why as we grow older, people come with knee and low back pain, first thing. And since this is the technology era, everybody is glued to their gadgets, and stress, lack of sleep, when it's, additional factors, they also get pain around the upper trapezius region. So most of the time they say that, oh, you have migraine, but then it's actually only upper trapezius tightness.
I remember Vivek going through that.
Right.
And it was so fully related to the stress he was handling at work. There was a point where he could only sit like this, Rish.
Wow.
Like if he brought his hand down, that pain just radiated all the way to the skull. Right. And of course, he treated him. It took a while, but it was completely stress related. Like direct correlation to stress.
As Dr. Sham says, right, we accumulate a lot of stress in the neck and the traps. So I'm sure after a release session for the traps, people feel a lot lighter. Not just because the trap is better, it's also, that stress has gone out.
Correct. I remember even when I used to when I had started running, little fast and everything, I think I used to stress about running. Okay. So when I stressed about running, I used to run like that on and off. And I had the same pain. And then apart from the release, I think what he taught me is that you're stressing. And that's also probably because, you're like not a complete run lover, but you still have to run. So those kind of stresses you're dealing with. And then when I started enjoying the whole process and understanding that I need to relax, I've never had it ever since.
This happens a lot at an amateur level, There's a lot of pressure that we take. In somewhere in between, we stop enjoying it. So we need to have a lot of gratitude that we're able to do all these activities. We are able to take care of the family. We are able to do our work. We have so many other responsibilities, unlike an elite athlete. For them, they just train. They have a whole ecosystem around them to help and support them. So that's where the difference lies. As amateur athletes, we take a lot of pressure. We push way beyond to a point, both more mentally than physically.
Let's talk about the aging population. I happen to, because of the kind of content that I create, a lot of, the aging population, older adults happen to follow me on Instagram, and I see a lot of questions around arthritis, around osteoporosis, and the fact that they've lost the ability to, for example, sit down in a cross-legged position on the ground. If they sit down on the ground, it's impossible to get up. they're not able to get into a deep squat. So a lot of questions around those things. And the one trend that I've seen is one after the other, movements are going out of their life.
Yes.
Like someone stopped walking, someone stopped getting into the deep squat, someone stopped just carrying their grandchildren, and things like that. So things are, and this is basic life. I'm not even talking about exercise, but things one after the other going out of their life. What is your advice for them?
Rishabh, I'm glad that you are educating and creating content, especially targeting our senior people. They are the most neglected, I would say.
Yeah.
Right. And we don't have that ecosystem which talks about do's rather than we speak about don'ts. You have knee pain, you're not supposed to bend your knee.
Yeah.
You have low back pain, you're not supposed to bend forward. Which research says otherwise?
Correct.
We have to appreciate it. If you have an existing range of motion, it's important to maintain it. If we do not maintain, it would get restricted. And once restriction happens, it's very difficult to again regain the...
Yeah.
So even if you see, exercise has never been our culture, in Indians. Even in our school, we are not educated enough regarding posture, exercise, etc. And even as people get older, they are asked to stop everything.
Correct.
Okay? Yeah. Maybe a little bit of walk, that's all. Even if you see to a greater extent, the social life also, circle becomes lesser.
Of course.
Right?
Yeah.
So all these factors do impact the body. And the other thing is also what they have done in their 20s, 30s reflect as you grow older. That's one more thing. And it's important for them to introduce exercise. Even WHO recommends exercise as the first line of treatment. Loading, first line of treatment. Lifting as first line of treatment. But then we have to take them gradually, handhold them and take them. That's
I've in fact seen so many, because when I train with you at Stairs, I've seen a lot of older adults come and train with you, and I have myself, from the external perspective, seen them improve. And I remember that the other day I was training with you, and there was another older woman who was training on the same floor, and she came and told him that yesterday I climbed 2 floors on the stairs myself, and she was scared to tell him. She was scared to tell him because she thought that, as a doctor, he's going to get angry that why are you climbing stairs? You've got knee issues. And Somya was like, that's why you train.
Yeah.
That's why you're coming here. Not just 2. You want to be able to climb 4, 5 and even more. So I think what you're saying totally makes sense. And we as a fitness industry need to do more for older adults in terms of exercise.
Absolutely.
But that said, what is your point of view on arthritis? Because, every time I put up a piece of content which is about exercise for older adults, they're like, I want to do this, and they feel helpless, but I won't be able to do this because I have arthritis.
Arthritis, osteopenia, osteoporosis.
Exactly.
Yeah. Now we need to first understand what is arthritis. It's a degenerative disorder. Now if I ask you, who doesn't go through that degenerative change?
Yeah.
We all are.
Yeah.
It's just how it is.
It's how it is. Yeah. We all are going through this degenerative and wear and tear process. That would continue throughout our life. Again, we have to see young adults as young as 25, 30. They have been diagnosed with arthritic changes.
Yeah, I have like
changes.
3 cases in their 20s at the gym.
Diagnosed with arthritis in their 20s.
Diagnosed with rheumatoid arthritis in their mid-20s, not even late 20s.
Yeah. So there are a lot of things that happen. It's very difficult to pinpoint at one exact cause. It's multifactorial. Multiple things. It starts with your lifestyle, your amount of stress that you take, everything. Everything comes down to extreme inflammation and stress in your body. And if you ask them, they would not have a history of exercise.
Yeah.
Muscle is, as I keep talking about muscle, is actually your armor. Okay? And you have to wear it. I always call it as your metabolic reserve. As you all know, that regulates insulin, resistant, and there's also an enzyme it secretes called myokine, and it reduces inflammation. So we need to train ourselves, and if you have muscle, it can combat many conditions.
Yeah.
Many conditions. So here, when we talk about osteoarthritis, there are degenerative changes as I mentioned earlier. So you need to recognize, like in osteoarthritis, everything is damaged around the knee. So your range of motion is restricted. Your cartilage, there's thinning of the cartilage.
Yeah.
There's morning stiffness. There's so many other factors to it. But then if you see, the range of motion would be full. But how do we call it as osteoarthritis? The question is that it's an umbrella term. There's so many conditions that happen around the knee. So we need to differentially diagnose and then say that, okay, you have this thinning of cartilage, which can get better if you strength train properly. If you exercise properly, because there are muscles to support the knee.
Yeah.
Right? And when they start exercising, they only do the knee extension exercise, which generally doesn't help. Because with that, you also need to strengthen the glutes. It gives you a better stability to the lower body, your calves. And cartilage improves with load. People do not realize that.
Exactly.
Maybe that's the mismatch, that people think loading is going to result in the injury, but the right way of loading will improve.
The right way of loading, it would improve. Yeah. Dosage. That's why we call it as exercise prescription.
What is happening to this? I know I'm taking like a handful of people and talking to you about this rheumatoid arthritis, the younger generation that are coming out. Is it more an autoimmune case?
It's a combination of both. We call it as autoimmune. Rheumatoid
no, the reason I ask is because you like you correctly said, the older population, it's a lack of just training, right way of loading, right assessment, all of those things, right? It's just one umbrella is, okay, arthritis, osteopenia, but then there's so many other reasons why. But I'm just worried for the younger generation. Like in their 20s, when you see more and more cases of rheumatoid arthritis, is it due to an autoimmune condition is what I want?
Again, I come back to the same point of they are told only don'ts. They stop living their life completely. Their life revolves around pain. Because that's the only thing that obstructs them, right? So rheumatoid arthritis is a condition, an autoimmune condition, but what it does to you is it causes pain.
Yeah.
That's what limits
joints,
movement. Yeah. Right? They could keep complaining of pain all the time. So what needs to be done, rather, with proper exercise dosage, they would get better over a period of time. And we have to educate them, make them more aware of this particular condition and then help them to overcome it, get better and stronger. They have to exercise, and then everything boils down to exercise. There are a lot of evidence, research, studies, which always speak about exercise as the first line of treatment. Again, I repeat. We cannot ignore it.
Exactly.
Yeah, because I remember you were a part of this case, the 21-year-old girl who, it was scary because when her parents explained to me her problem, an autoimmune condition, she was like, there was such zero muscle strength, like her eyelids wouldn't open. There was no strength for the eyelids to open. Like she was this way most times. And then she was on steroids and all of those things, and then cut to, she came and started exercising. Right. Under the physiotherapist's NSNC guidance.
Yes.
1 year, she got off steroids, she became stronger again, but her loading was so well planned because she started with body weight, then moved to resistance band, then moved to lightweight, and then to moderate weight. And now her parents have confidently sent her out of India to pursue her higher studies without any, stress about it recurring. And the doctors were shocked to see how this, of course, she's young and it's probably easier to push as well. But the fact that she got off steroids way before the doctor had planned. Yeah. And I mean, it's amazing.
Amazing.
Because the parents are forever thankful for such.
But this is what exercise strength can do. I always keep saying, this is what exercise strength can do. Even you need to have one sport in your life, very important, at least one. And you need to exercise.
Yeah.
Very important.
Fully agree.
I love how he says you have to have one sport and you have to exercise.
Yeah, I think sport mainly it's not just for the body. Sport teaches you how to make decisions.
Exactly.
It prevents cognitive decline. And cognitive decline is the first thing that happens that's the first symptom of aging.
Yes.
And sports, and I've Nadal's book or My Story, he says that in the sport of tennis, And he is giving example of tennis because, that's his sport.
Yeah.
Every second, every fraction of a second is an emergency. I don't have the time to think as a tennis player, and my brain knows how to make that decision. Every time you swing your racket, you want to toss it which side of the court and what move to make. All of that is on autopilot.
Yes.
And that's fast decision making.
Correct.
And you don't even know how it starts translating to your real life. And that's the magic of playing a sport. So I fully agree.
Yeah.
People should never stop playing a sport.
Yeah.
Running can be considered a sport?
It is, of course.
Because that's what I do day in and day out, so I want to be sure.
Shweta,
Yeah, it is a sport. No, I just want to hear it from you
people-
saying that,
people-
yes.
People, that's the problem. People do not realize this is a sport.
It is a sport, exactly.
That's why we call it fit to run.
That's why that's going to be my
Running.
next question,
Okay.
right? Everyone wants to run now,
Right.
okay? But I feel like also some amount of it is FOMO, right? Fear of missing out. Oh, she's running so well. He's running so well. I also want to run. And there are 1 million run clubs,
Yes.
right? Which is amazing.
Amazing.
Great.
Which is amazing because we're just getting more people to move,
Yeah.
Yes.
right? And which is exactly what our goal is. But I also see this with running too much too soon happening. And most people come back with, again, hamstring, calf, shin splints, knees, IT.
Stress fractures.
Yeah.
Yeah.
So many stress fractures. And, we're seeing it day in and day out.
See, again, running is a normal movement pattern of the body.
Yeah.
Okay. But unfortunately, if I ask people, when did you run last? They would say in school. And there has been a long gap.
Yeah.
Long gap. And when they want to get fit, they think about running, right? It's the best way. But running is also a high impact sport. Okay. You need to appreciate, recognize it as a sport, learn and assess, learning about your body, your imbalances, the way you run also plays a very important role. Learning about the biomechanics of running, how you absorb forces when you run, take that impact. Your history, your medical history, very important. Everybody needs to undergo ECG, echo, TMT to understand what the condition of your heart, your lungs, how they function together, and a better assessment of a musculoskeletal system. So when you take this sport, they only run. They do not prioritize strength training.
Yeah.
That's one because muscles would support your bones, your joints, okay, to produce better force when you run. When that is neglected, overuse happens, overload happens, where stress fractures, tendon injuries have become more common now.
Yeah.
So I always say, learn to walk and then run.
Yeah.
Okay. You need to first start with walking for longer distances because now if you see, people do not commute. They do not hardly walk.
Yeah.
They don't even climb stairs.
Yeah.
So the lifestyle has changed to a greater extent, and when you start running, there's a lot of stress to your body. So rather, more benefit, there's a lot of harm that it causes because you're not mindful about it.
Yeah.
So running is great. Everybody should run. But we all need to be more mindful about how do we approach running. There's a lot of work that needs to be done behind. And then slowly progress. Timeline is very important. As she mentioned, too much is too soon. So everybody wants to run a marathon, but in 3 months' time, which never happens.
Yeah.
You need to have a background, a history, and then plan it. Okay.
Correct.
So if she does it in 3 months, everybody can't do it in
I was just going to say that everyone wants to run a marathon in 3 months, and it won't happen unless you are Shwetambari Shetty.
Shwetambari. Okay.
It's my day.
So you need to train. You need to train over a period of time because you are an individual. You have your specific strengths, imbalances, and gradually develop yourself because you are an amateur. You can't dedicate only your entire life only for running.
And what about the other sports which are now becoming very popular? And I'm a fan of all of those things.
Yeah.
I think anything that's getting people active, moving, anything that's getting them hooked to playing a sport, that's great. But there are things like we are doing Unbound at
Cult
Cult.
Unbound.
There is High Rocks.
Yes.
Yoda.
There is Yoda, and then there's pickleball, there's paddle, and all of these sports
Devil Circuit.
that have just been happening, and people are jumping onto it, which is great. People are getting active, like I said, and it's only going to increase. I mean, I don't see that slowing down, and which is really good for us as fitness professionals, for the industry, for the entire country. But as a physical therapist who deals with pain and injuries all the time, what is your advice to people who are jumping onto these sports now? What is your advice in terms of getting them to stick to it for a longer period of time?
Yeah, we need to think, as a very good point, we always need to think about, if I want to run, can I run throughout my life?
Yeah.
Okay, can I play this sport over a long period of time? This is what we miss out on. Everything, again, starts with a proper assessment. Screening is very, very, very important. To that extent where, smaller things need to be taken care of, like the way you move, your nutrition, your sleep, which is underrated the most. Everything is important, and you need to plan your calendar in terms of how many days of strength training, how many days you are going to play pickleball or any other sport, and start preparing towards it. And exercise, strength training revolving around the sport, more specific to sport that you want to play. So if you do all these things and warm up properly, prepare yourself before most of them, they take it very casually. They don't even warm up.
Yeah.
So as those say, it's very simple. I just move my arms and legs and get in. It's not about that.
Yeah.
You need to prepare yourself, learn about how the way you land, the way you move, because most of the injuries happen the way you land.
Yeah, and I've seen that myself.
Basketball.
In basketball, I play regularly. I've seen like ACL tears happening right in front of my eye, without anyone trying to block them.
Non-contact injuries.
Non-contact injuries. Someone goes for a layup, converts the shot, lands, and the knee is broken. And looks like a fit guy. He's playing good basketball and things.
Sudeep, no?
Yeah.
His ACL tear was like that only,
Yeah, and
landing.
Exactly. So my
basketball.
hypothesis was, and you correct me if I'm wrong, people know how to jump. They don't know how to land.
Yeah.
True.
Yeah.
And that's where things go wrong.
Yeah. That's why we have to train, learn, let the brain understand the movement. Most of the injuries happen because the brain doesn't recognize.
And what's your point of view on plyometric training? People are scared of it. People are shit scared of it.
No, there's a way to approach it. Very important. And rather makes you stronger.
Exactly.
Yeah.
Improves the quality of your tendons.
Exactly.
Okay.
Yeah.
But then we have to approach it
Systematically.
Yeah, systematically.
Yeah.
Like, for example, learning to land.
Correct.
Like, snap down is a very important exercise, but I would say learn the movement. Snap down, where it's more than jump, it's the way you land.
Yeah.
The way
The absorption
happens, right? Then slowly, start doing pogo jumps,
Yeah.
pogo hops. Okay.
Yeah.
Stand in one place and jump. Let the brain, let the body, let the joint feel the load, and then go for stronger jumps, box jumps, etc.
Exactly.
So we have to always talk about multi-component fitness routine. We have to train in all directions. Like runners say, "Oh, I run. Why do I need to train my sideways
Lateral.
movements?"
Correct. Yeah.
So the force is only in one
Forward.
plane.
Linear.
That's where maximum injuries or stress to the bone happens. What if we add lateral movement into the routine? It makes your bone more stronger.
Correct.
Yeah.
So when we add these simple things into the routine and make them more aware, the problem happens when they're not aware.
Yeah.
They do not understand about the session. Where most of the time, we have to tell them what is this session all about. We have to educate them. This session is all about loading today. We'll be loading you. So warm-up would involve these things so they're mentally prepared. Okay, this is what it is coming. Like, Shwe, even my touch space, we have 5 days.
Yeah.
And they know Monday is this, Tuesday is this, Wednesday is this, Thursday is this.
Yeah.
So we focus on all the components of fitness. May it be stability, may it be endurance, may it be high intensity, may it be power, explosive. All the components are taken care of, balance, everything.
Correct.
So when it's more wholesome and holistic, you get more stronger.
Yeah.
Always.
My only concern for everyone who's participating in all these competitions, like we think it's amazing that there are these opportunities for people to come out and do these competitions. But I've met a whole lot of people who have signed up for these competitions without even knowing enough about the movements.
Yeah.
Yeah,
Now,
that's
if you're
the
going
FOMO bit that we're talking about.
Yeah, like, the friends, okay, you are doing, I'll also do it with you, or whatever, the FOMO, the community, all that. And then you only think of doing these exercises 2 weeks before the competition. Or I also know of individuals who've done wall balls for the first time in their life at the competition.
Interesting.
So I'm not worried about the injuries here. Like, okay, you may have some niggles, etc. Form may be off. But what happens also is that you develop an aversion to the sport.
Yeah, you stress
because you've stressed so much and you're like,
Right.
I'm never doing this again.
you spoil the relationship with the sport.
Exactly. That is my problem.
Yeah.
Injuries you'll get through.
Yes.
No injury is permanent. You'll get through it.
Actually, that also impacts your body so much
Yeah.
that in the future, next 2-3 years, it would start showing up.
Exactly.
Correct.
So,
Exactly.
Like I said, approach strength training more mindfully
Yeah.
rather than creating more stress to yourself.
Exactly.
Because strength training is also a sport.
Exactly. Exactly. Like I know Vivek, my husband, of course, he, at one point, when he tried running, he ran 200 meters and his hamstring was jammed. This was months ago. And he's like, why am I trying this at this age again? I don't like running. I'm never doing it. Cut to months later, with a very proper, meticulous approach, now is training for high rocks.
Yes.
But
right,
Vivek
which
is
involves running.
and Vivek is a fit guy. Yeah? He can. I mean,
And
I've
he
seen him do
couldn't.
100
like his
burpees in
calf
like 5
and
minutes.
calf and hamstring always jammed every time. Now he's able to do 5-6 kilometers without pain.
I mean, see,
Because
and
the approach was smarter.
Yes.
I'm saying, and this is someone who can do like unbroken muscle ups for reps and do 100
but
burpees in
exactly.
5 minutes, and 200 meters he's feeling in the hamstrings. So
Exactly.
like you said, it needs to be sport specific. What about
This can go
so
on.
there is also I mean, women generally lose muscle and bone faster than men, and when they're in perimenopause and menopause, they just lose it, like bone mass goes off really fast. What's the piece of advice for them?
So instead of thinking about menopause and perimenopause, we need to start ensuring that, okay, I'll be in a few years' time.
Yeah.
I'll be reaching that stage. So let's start working on muscle, which is very important. Start exercising, start loading appropriately, which can help and support you throughout your life.
Yeah.
Exactly. That's what I keep telling all the women. Embrace it.
Absolutely.
Don't
That's the right
whine.
word.
Don't complain. And this I've learned from the Japanese culture. Like apart from just reading, going to that country multiple times and having a friend who's Japanese, she tells me that women here don't think about this as a phase.
Exactly.
They don't call it out.
Yeah.
They just go with the flow. Yes, their food better supports the whole peri and menopause and everything because of how they eat, the omega-3 rich food and etc., which not all of our women are eating. But they just make it a part of their life. They embrace it fully and they're very positive and welcome about the phase. Which is what I'm trying to educate our women, saying that it's okay. It is fine. It is a process, like like puberty, like
Correct.
That whole phase where you've just got your periods, then you have to get pregnant. Everything is a phase,
Yes.
but act on it.
Yes.
Don't embrace and sit down.
Yeah.
Act on it.
Yeah.
Right. You need to do the right things.
So strength training, and if you can answer this question, I know it's like as early as possible. Men, women, everybody should start strength training even in their teens, and they should never stop. But for women specifically, if they've never trained before, like what's that number? What is that age after which it's like you have to start? It's a non-negotiable.
See, there is no age. You have to start exercising. There are milestones as kids, okay? But once you pass that phase, exercise has to be. See, again, I come back. It's our responsibility to speak out. Speak out really loud in terms of what exercise does to your body.
Yeah.
Many do not speak about it.
Yeah.
Like Shwe was talking about education, speaking about this process of that happens. Every women go through.
Yeah.
They need to understand that what is the solution instead of thinking only about the problem. the solution would be to exercise and get stronger.
Yeah.
Better late than never, right?
Yes.
Yeah.
So that is.
I just want to give you an example here. Again, personal experience. My aunt, Chandni,
Yeah,
you remember
Chandni.
she ran 10K,
Yes,
her first 10K.
How old is she?
She is now 73.
And ran a 10K when?
Ran a 10K 2 years ago.
At 71.
Yeah.
Wow.
70 or 71, yeah. Her first 10K when
Yeah,
we trained everybody for the TCS.
She's the one who does
2024.
handstands and stuff?
Supported handstand,
correct.
headstand. She started strength training at age 60.
Wow.
When she retired from her job.
Right.
And then she's like, oh, I have time in my hand and, like, what do I do with my time? And she was a banker. So her lifestyle also was quite sedentary, but in general, walked and kept her brain active because she loves reading and, like some sport, swimming, walking. But her strength training journey started at age 60.
Yeah.
60 or a little after 60. So better late than never.
Whenever you can, you need to start exercising. She realized it later because nobody told her.
Exactly.
So that's all about it.
But her
the
quality
more-
of life is great at this point. So
That's the thing about exercise.
yeah,
no?
that's
I
the
mean,
thing about
I always tell people, you start lifting weights and training at 60.
yeah,
You train for 10 years.
yeah.
At 70, you will be looking and feeling better than how you did
yes.
in your 50s.
Absolutely.
That's the power of exercise.
Absolutely.
Correct. I think we're all examples, no? If we look at our photo 10 years back, we look better today than what we looked 10 years ago.
And I'll give you another example. My mother.
Yeah.
And my mother, she's 63. She's going to be 64 this month. She trains regularly. She's had a very, very stressful past. 25 years of very stressful marriage with my father. Financial struggles and all of those things. So her life has not been easy by any standards. But one thing has remained. She's always exercised. Whatever she understood back in the days, she would do mopping and cleaning and carrying, bucket full of water and things like that, up and down the stairs. And she treated that as exercise. So she did a lot of it. Right now she does structured exercise at a gym with a personal trainer. She's also got scoliosis, for which the doctor, when they saw the x-ray, they were like, how are you even walking? But 64, she looks young. She looks extremely fit. She's very functional. By the time a lot of us wake up, she's done with 15,000 steps. She's done with her exercise. She walks to her gym, which is about 1.5 kilometers, and she walks back. I think all of this is possible because she's always been exercising.
Exactly.
Yeah, Rishabh. I mean, as I always say that there's a difference between motivation and discipline. Motivation is short-lived. I mean, you have motivation, you do it.
Correct.
But discipline is throughout your life, and this exercise should be inculcated into your routine every day and should become a discipline. Irrespective of what, you should exercise at least, if nothing, 30 minutes at least.
Yeah.
Which is not very difficult. People say, I don't have time, I don't agree.
Yeah.
I mean, if they can give 30 minutes just 2 or 3 times a week, I think that's like
Big change.
solid win. Yeah, and that's going to change their
No
life.
time is, it's finding an excuse basically.
Yeah,
No
I
time
agree,
is excuse.
completely
It's not
agree.
a reason. It's sad that it'll take a whole lot of us to keep reiterating this 1 million times before we get everybody to come out and work out.
We have to do
It's
it.
getting better for
Just
sure.
to keep doing it.
Yeah. Like, for example, when I was working with the Indian football team, I used to take sessions for kids, 16-year-old, 19-year-old. So every session I go, I have to repeat one sentence again and again and again and again. And I'm not supposed to get irate or irritated because they're asking me the same question again. Okay. So that's how I feel we as physios, SNC coaches, sports scientists, everybody in healthcare need to speak and speak what evidence tells us. For example, back pain doesn't mean that you should not bend. We always speak about don'ts. We need to start speaking about do's as much as possible. Solution rather than stopping movement.
Now, since you've worked with Indian football team, so elite athletes and also kids in their teenage and things, what's your point of view? And the reason I'm anchoring this question to sports and teens because parents are generally scared of introducing their children to weight training because they feel it'll stunt their growth, height ruk jayegi and things like that. But they're enrolling them into football and sprinting, track and field, which is also very high impact.
Yes.
What's your point of view as a physical therapist and someone who's worked with, kids at an elite level, what's your point of view on weight training for youth?
See, as young as 14-year-old, we included a lot of exercises, routine, strength routine, where we included barbells, dumbbells, and they all got stronger by the day. The challenge here is right from the age of 3, 4, 5, 6 onwards, there are different milestones that kids reach. And we need to start implementing and encouraging or finding a way where they're exposed to developing that milestone stronger. For example, coordination, balance, hand and eye coordination, for example, I'm giving. So all these development happens. And when you are able to now if you see kids do not even crawl, they say it's dirty. They don't want to go there on their knees. Again, all these movements are extremely important. Right? So as they grow older, they need to be introduced to exercise. They need to have an exercise session. Start with body weight. Include a lot of plyo, jumps, etc. So that's how you start including slowly resistance bands, dumbbells, and by the age of 10, 12, you are holding a dumbbell and exercising.
Mine is holding at 5.
And she's teaching you burpees.
That's fine, absolutely fine. But lighter weights, obviously.
Yeah. So it's not going to stunt growth.
No, it doesn't.
It cannot.
Doesn't stunt. It cannot stunt any growth.
In fact, it'll help. I mean, not help
Stronger
grow taller,
bones.
but it'll help you.
Stronger bones.
It'll help you get stronger.
Yeah.
So you growing in height, everything depends on your genes.
Exactly.
Yeah. So Yona, my daughter, she creates her own little circuits. And Rish, I'm not kidding. Every time she creates these circuits, like recently at one of the gyms we were at, she saw the ladder, so she pulled out the ladder and she pulled out the those parallel bars, the small ones, light ones, which you can do push-up, deficit push-ups and all of that. And in my head, I'm like, how at this age you're able to create your own circuit? This reminds me of Somya, by the way. In fact,
Somya creates circuits.
Those circuits, right? And in fact, at home also, she'd bring cartons that are full. She'll do box jumps over it. She'll keep a football and she'll do something. And I've taken videos of it and sent it to him, saying that this girl is doing all these circuits. It's as if she's already seen or worked with you.
No,
You know what I
kids
mean?
watch and learn. I'm telling you, she watches you very closely.
Yeah, she does.
Watches all of us very closely.
Yes, through videos and etc. Yes.
So
it's amazing.
And they're creative.
yeah,
And they're
extremely
Extremely
They do their
creative.
own. Yeah, it's amazing. So to your point again, I think they're going to learn from their parents, the next generation. So the more we show them the importance of movement at the right age, they will just follow it through and see it through. No education is needed. It's happening at home.
But I think a great point on, parents of, toddlers and young kids, stopping them from foundational skills like crawling because the floor is dirty and things like that. And I have, another example on that. Kids at that age, they start walking backwards.
Yes.
When my son started walking backwards, I saw a lot of people tell him, "Arey, lag jayegi," and things like that. And I always tell people, let him do what he's doing.
Yes.
And I read up on it, and I realized that it's a milestone. They are learning proprioception by walking backwards.
Exactly.
And if you stop that, it's going to show up when you are 20, 30, 40, and it's going to manifest as injuries and pain.
Correct.
So that's the impact of fighting against the natural.
See, as parents, we become more protective. Yes. But then, when they move, we have to appreciate each and every movement, encourage them as much as possible, but obviously in a controlled environment.
Yeah.
Absolutely.
Awesome.
Amazing. So if there's one advice you want to give your viewers / listeners, one habit change they can do from tomorrow, especially for the ones who don't work out and.
No, I would say that movement, exercise, we need to start considering it as medicine.
Yeah.
It would cure many, many, many illness. We need to start recognizing it.
Yeah.
Understand more about your body. Learn about it. Everything is available. Learn about it. And do meet healthcare specialists to know more, and so that you have a more structured way of developing rather than randomly following something and trying to push themselves way beyond.
Structure in everything you do.
Optimal loading is very important. Understand what is optimal loading, very thin line, and also need to recognize what is overload, overuse.
Yeah.
So that's very important. Very, very, very important.
Yeah. We've spoken about Somya so much on this podcast before, and a couple of our guests have spoken very highly of you.
Thank you.
So in fact, we were already getting requests from our viewers.
Yeah.
To bring Somya.
Yeah, because Shreyas Hosur, Tejasvi Surya.
And the both of us.
And of course, the both of us.
I'm privileged.
Yeah.
I'm privileged. Thank you.
So if people have to reach out to you, what's the best channel?
Call Stairs Physiotherapy, not Somya. I mean.
Of course. He's a very, very busy person.
Yeah. But I'm sure you also get this, but for the last few years that, I've known you and people know that I've been coming here, I'm also one channel for booking with Somya.
Oh, me too.
Exactly. Yeah. That's what I meant. You should also. Because I've become a just dial for you for so many other things, but for now we'll talk
most
about
of the
you.
Time, might be a little late, but I'll find time. I'll ensure that.
No, I'm gonna take this opportunity to express my gratitude also with my lower back situation. You've seen it.
Yeah.
I had and I love to lift, and I stopped doing most things at the kind of intensity that I'd like to do. Trained with Somya for 6 months last year. Touch wood, my back is like better than ever, and I don't have to be scared.
Somya.
I'm not worried about the fact that I'm going to jinx it or whatever, because I have Somya Rout in my corner.
Thank you so much.
There's no
It
such.
really means a lot. I'm overwhelmed. Thank you.
When I'd hurt my shoulder recently,
Swimming.
I thought I'm going to pull out of High Rocks for now and just focus on fixing it. But it's been a couple of months since I'm now rehabbing.
Yeah, I don't think you needed even a week or so, like 10 days.
Yeah, that I think he got me in really fast. Like first session was he released it off and then easing me in. From the second session itself, I've been pushing hard. But I think now in a couple of months I'm more confident of going to the event than I was before getting injured.
Correct.
So thank you so much, Somya.
Thank you, Rishabh. Really means a lot.
A note to all our audience: if you want to reach out, Stairs Physiotherapy and Fitness.
We'll have to clone you.
Yeah, you might not get an appointment. That's it.
There's only one. Yeah. Agreed.
Yeah, Siri says it. That'd be great.
There's only one Dr. Somya Rout. So either you should work on creating more.
Exactly. You need to train more people.
Yeah, no, I always say my team is really good. I'm blessed with a great team.
Oh yeah, I agree.
Across all the
Fully
4 centers, I'm blessed with a great team. At times I feel that because of them, Stairs exist. It's not
absolutely. It is teamwork, but that's we were talking about how it's probably your approach, right? Like I told you, another member, she was telling me she had quite a lot of knee pain and she's gone to multiple. Of course, it's been fixed, coming back. Like there is fear then that, oh my God, if I do this, if I do a lunge, if I do like a heavy lunge, it's going to come back. But then she was like, I think when I load with Somya, what happens is he plays with my mind so much that I forget about the fact that I have pain in that area at all.
I think it's not, it is mine, but it's also the fact that he's just watching you and he's going to push you only when you are confident.
Yeah,
and also,
so I think that approach is something that people need to learn. It's not,
the exercises are, as physiotherapists, you need to be good exercise therapists. I always say you need to screen movement as early as quickly as possible, and design programs which would, again I say, empower all the time. It's not about causing harm or discomfort. I'm so proud of my 7 a.m. batch. I'm telling you, there are close to 20 people who come in the morning.
Yeah.
And they all had aches and pains in different parts of the body. May it be knee, may it be low back, you name it. And they were all not moving. Now they're all into a sport. They're all doing so well, managing pain, overcoming it, and getting stronger by the day.
Yeah.
So that's something which I feel is a great success.
It is.
Yeah, of course.
And
Empower. That's
Yeah,
yeah,
yeah.
You're right. We want to empower them.
Exercises.
They're like
empower you.
Yeah. Okay.
amazing.
Thank you very much, Somya.
No, thank you.